This is a presentation for the paper, Understanding Human-AI Collaboration in Music Therapy through Co-Design with Therapists. My name is Jingjing, and I will be presenting the paper on behalf of my co-authors. Music therapy is a systematic and evidence-based clinical practice that uses a variety of musical activities, such as music listening, music singing, music instrument interaction, or music composition, to intervene and improve clients' mental health condition. With the emergence of artificial intelligence, a new area of research has arisen regarding adapting AI-related musical activities or musical AIs into music therapy. Musical AIs have the potential to improve treatment efficiency and diversify treatment, aligning with both the technological practice and needs of music therapists identified in previous research. Current musical AIs can generate music in specific music genre and define the instrument combinations. Deep learning models can even create melodies that manifest certain sensations. Beyond the mere compositions of melodies, other AI-based musical tasks, such as music style transfer, harmonization, tone transfer, and emotion-based music generations, are also emerging. Such technologies could have the potential to increase the effectiveness of music therapy. However, despite the benefit of musical AIs, incorporating AI technologies into music therapy may require therapists to acquire new skills, to use new software or electronic device, and influence their original workflow. Due to AI's output complexity and capability uncertainty, most of the early studies on musical AIs stem from algorithm point of view to explore the potential of combining music with technologies. Although the field of research on musical AIs is still in the early stage, it is necessary to understand music therapy's opinions on current technologies and how these technologies will be integrated into or take place in music therapy. Specifically, we raise several research questions. What are therapists' view on the current music AI technologies? How do therapists think music AI can assist in the therapy process? What concerns do therapists have about the applications of musical AIs? To answer the above research questions, we conducted semi-structured interviews and 2 co-design workshops with 14 practicing music therapists specializing in treating emotional issues. During the workshops, we engaged participants who use current musical AI technologies to create treatment plans for 2 pre-designed cases, including the prevalence of emotional issues. Due to the various methods that music therapy includes, we require participants to have experiences in treating clients with anxiety, stress, and depression. We recruited participants through snow sampling and online advertising on WeChat. All of the participants are Chinese. However, some of them have working experiences in different countries. Before the workshop, we examined various state-of-the-art AI music technologies and selected several representative works to be the AI materials for our study. We categorized the selected models based on their functionalities and divided them into 5 categories. We handled the AI learning materials for our participants 3 days before the workshop. We also noticed that music therapists have varying expertise and treatment methods. Meanwhile, as their treatment is client-centered, we designed 2 cases related to emotional issues related to depression, anxiety, and stress, which are the top 25% of increased mental health problems triggered by the COVID-19 pandemic. We diversified the 2 cases based on gender, age, personalities, music backgrounds, and emotional problems to reflect the different client groups. This approach would allow participants to have more design possibilities. During the workshop, we asked our participants to use musical AIs as a tool to create treatment plans for the 2 pre-designed cases. We asked participants to report their design outcomes with all the participants and make comments based upon. After the design workshop, we invited participants to participate in individual semi-structured interviews where we asked about their experiences during the workshops and subjective feelings about musical AIs. We collected data from all interviews and co-design workshops, including video and audio recordings. Thematic analysis was used to conceptualize themes from the co-design workshops and the interviews, and further follow with an inductive open coding approach. The 2 researchers carried out initial coding, and as the analysis progressed, the conceptualization themes were discussed among the research group members. There are 3 key findings from our study results. In finding 1, we summarize the typical workflow that utilized as a working procedure and identify the following treatment plans participants create for our pre-designed cases with musical AIs. Throughout our design workshop, the workflow of music therapy around emotional issues can be divided into 3 phases. 1. Information collection. 2. Emotional problem solving. And 3. Treatment consolidation. During the phase of emotional problem solving, the therapy uses music to address and work through the client's emotional challenges and issues. In finding 2, we summarize the potential benefits of musical AIs on music therapy into 5 categories. They are increased therapy efficiency, enrich the content of music therapy, enable more customized content for treatment, increase client engagement, and expand the range of clients. In finding 3, we listed the key challenges music therapy face when attempting to use musical AIs in music therapy. 1. Music therapy is specialized and complicated, which includes its intricate nature, the high requirements for quality and robustness, and also its diverse needs. The second challenge will be the musical AI technology limitation, which include the performance doesn't meet expectation, the low operability, and its uncontrollable performance. Last but not the least is the unclear role of therapists in human-AI collaboration. In discussion, we have outlined 4 design implementations for future human-computer interaction studies on leveraging musical artificial intelligence to support the field of music therapy. 1. Support in creating personalized treatment content. 2. Incorporate domain knowledge of music therapy. 3. Support the music therapist's control in musical AIs. 4. Support multi-stakeholder interactions and operation. In sum, we conducted semi-structured interviews and co-design workshops with music therapists to understand the opportunities and challenges of integrating musical AIs into the current music therapy treatment process.